It's my great pleasure to talk about one of my favourite subjects is water. Sadly, being a scientist, I love water, and I love Pseudomonas aeruginosa. That is my favourite organism. As a scientist, you've got to have a favourite bug, haven't you? So yeah. So I think the title of my talk tells you what I'm going to talk about. I'm going to give you a little bit of a story of some of the work that we've done. It's lovely to talk in Birmingham, and obviously I work at University Hospitals Birmingham, what is literally just over the road. That's Heartlands, and we've got the Queen Elizabeth Hospital, Good Hope Hospital, and Solihull. So we encompass the majority of hospitals in Birmingham. So nice to be close to home. Straight back to work for me after this, anyway. So some disclosures, and this is just some of the grants we've been in receipt of around some of the work I'm presenting here today. And a big shout out to Professor Martin Kiernan, who was integral into like the Sink Splash Zone and the work that we did. So these are the hospitals I work at. Like I said, just over the road. The majority of work I'm going to talk about is at the Queen Elizabeth Hospital in Birmingham, what's just down south a little bit, and that's where I'm going after this. We're a conglomerate of hospitals, and it's about 3,000 beds in total, so it's a massive hospital, probably one of the largest hospitals in the UK, if not the largest. So like I said, I'm going to give you a story, and eventually I'll get to my point at the end. So my favourite bug is Pseudomonas aeruginosa. Why I love Pseudomonas aeruginosa, I don't know if anyone's ever looked at it on an agar plate, but it's like me being weird. It smells a bit caramelly. It's like fluorescence. It's got one of the largest genomes in the world, and it's very, very good at creating biofilms. I'm not going to talk too much about biofilms because we've got Jean-Yves who will give a great talk on that anyway later. Pseudomonas is an opportunistic pathogen, and it's often associated with water. We can find it in the water. If you go looking for it, trust me, you can go find it in your sinks, in your taps, and everything. So a biofilm is like a city of organisms, and it develops. I don't know if anyone's sad like me and look down your taps and look down your drains at home, and you find a big gloopy material. That tends to be a biofilm. It's a city of microorganisms, and they're very, very difficult to dislodge, as you can see here. And if you go into the hospital as well and you look at your taps and your sinks, you'll find biofilms. I don't know if can you see the green on there? Can you see it? Yeah. Well, that's a bit of biofilm, and with Pseudomonas aeruginosa in there, so you can see it. So I'm talking a little bit about water today and the risks of water. This is not a new phenomenon. Some of the great researchers of our time, Professor Graham Ailiff, you may remember him, or you heard of him. This was reported many moons ago in like the 1970s around the risks of Pseudomonas aeruginosa from sinks and water and what have you. Then it came more to fruition in 2012, and this is where I learnt my trade as a clinical scientist. Where I did all my training was down in Bristol, maybe where I first got, weirdly, my love of Pseudomonas aeruginosa. And there was a big outbreak of Pseudomonas aeruginosa in babies, where babies passed away. And we've got a great talk about neonatal water after mine, and there's a big outbreak in Belfast as well. So we found that Pseudomonas was transmitted from the water to our patients in the neonates. So now I moved to UHB, and one of my first jobs when I moved to UHB as a clinical scientist was looking into surveillance and within the infection control team. And just so happens my favourite bug, we had an outbreak of Pseudomonas aeruginosa in our critical care unit in our burn shock room. And what happened here is 5 patients successively went through the burn shock room, and all 5 patients had Pseudomonas aeruginosa. Me being me, I thought, let's go and get these typed to see if they're linked, and we found they were linked, and we even found it in our water. Even when we did remedial work, we found it again, still in our water. So we had a bit of a link of finding it in our patients and finding it in our water. So the Department of Health very nicely gave us a little bit of money with a great clinical scientist called Fenella Halstead and Mark Niebel with Beryl Oppenheim. And we wanted to look to see what the role, if there is a role of transmission of Pseudomonas from the water to our patients in an adult intensive care setting. We found it in neonates, so what about our adults? So this was only a small study for 6 months. And what we did, we sampled water at the beginning, sample all our water outlets at the beginning in our ITU, in the middle, and at the end. And at the same time, we collected patient isolates of Pseudomonas aeruginosa, where the colonizations and infections, and then we did whole genome sequencing on our water outlets and our patient outlets. We're quite lucky at UHB, or maybe unlucky, so over at the QE, our intensive care unit is about 100 beds, huge amounts of beds when you think about that, co-located critical care unit. And not so good for me, there's 231 water outlets on my ITU. That's a lot of water outlets, isn't it? So when we sampled it, what did we find? We found about 30% of our water outlets had Pseudomonas aeruginosa in. Interesting and quite worrying. So what did the results show? This is a really complicated, big dendrogram, whole genome sequencing. But what we did find is we found our water and our patient isolates were related similar. So we had about 60% of our isolates, patient isolates, matched our water isolates. So you could directly confirm that we had transmission from our water to our patients, or our patients into our water. So we had a link then. So obviously we didn't leave it like this. We did various different service improvements, and all the papers are here. And hopefully you can see this graph here, and it just shows you the rate of Pseudomonas aeruginosa on your left-hand side, and some of the interventions of the boxes and the reduction down in the rate of Pseudomonas aeruginosa. So the first one, number A, you remember that outbreak I told you at the beginning in our burns unit, burns critical care shock room? We put filters on and we reduced it down a little bit. Then we did holistic factors, so how we disposed of wastewater, how we cleaned the taps, and we found more reductions. Then obviously there's engineering solutions as well. We replaced the tap outlets and reduced down our rates of Pseudomonas aeruginosa bacteremias on our intensive care unit. Holistic factors of like, has anyone ever tried to clean a tap in your hospital? Has anyone ever tried to clean a tap? Well, maybe the take-home message from this paper is you don't want me cleaning your taps. So what we did, we put some UV cream in a tap, and I tried to follow the method of cleaning your taps. And can you see that top picture? That's where I spread the UV cream. I spread it right to the tip of my tap. Yeah, like I said, you probably don't want me cleaning your taps. But when we did a different method, like thought about it, how we clean properly, you manage not to spread it around. So if you imagine you had Pseudomonas aeruginosa in your sink, you can see how you can transmit Pseudomonas aeruginosa around. So what about other areas? So other augmented care areas. We've not only looked at the intensive care unit, we've looked in our hematology unit, and we've looked in our burns unit as well to see if we see transmission. And there are anecdotal reports, and we've seen as well that you can get transmission of Pseudomonas aeruginosa in these areas as well. So we had an outbreak of Pseudomonas aeruginosa in our hematology unit, where 3 patients in one room after another had Pseudomonas aeruginosa in their central line infection, central line, and thought, well, that's a bit weird. We typed them and found they're all the same. And I'm thinking, well, how have they got Pseudomonas aeruginosa? Where's that come from? I've got filters on all my taps. So I went up, had a little look. Oh, there's one sink that didn't have a filter on that, and that was in my IV prep room next to some IV trays, you know, where you take the IV drugs to your patient, and we found Pseudomonas in the tap. What's the same Pseudomonas in the patient? And you could find it on the trays. So you can see how practice in human factors plays a part in that as well. So we're lucky enough as well to have the regional burns unit as well. This looks like a complicated diagram, but it's not. But what it's telling you is we can find transmission in our burns unit as well. So if you take like box 4, can you see box 4? So the blue is like water samples. So we can find a patient in a patient's room. We can find the water has Pseudomonas aeruginosa. We can find their burns wound samples can have Pseudomonas aeruginosa, and the environment can have Pseudomonas aeruginosa. And that box together shows that they're all related. So by whole genome sequencing, they're exactly the same. And you can take other patients, and we did a longitudinal piece of work, so we can find Pseudomonas aeruginosa in our water, in our patients, and in the environment. So again, more evidence that we can get transmission of Pseudomonas aeruginosa in this setting. So hopefully this video will play. Maybe I might need some help to get this video to play. They're going to, yes, here you go. This is a water droplet. Can you see that? Yeah, yeah. Yeah? And can you see all the little spray off that water droplet? Yeah, yeah. So just imagine if that water droplet had Pseudomonas aeruginosa in it. Look how far it can spread. So it can spread. So you can see that. Or just imagine if that water droplet dropped onto a sink trap, and you can see all those organisms can spread further out. So that led us to, there it is again for you. So nice little splash zone. Has anyone looked down your sink? What you find down your sink? Oh, I will always look. This is my favourite slide. One of my consultant microbiology colleagues, Liz Holden, who does a lot of work, and you see on these papers, she always goes under the radar, and it's me who's presenting. She hates this picture. I love it, but that's probably me because I'm a boy. Maybe because I'm a boy and a bit weak. Hasten to add, these are not all in our hospital, so just these are from others. But look what you can find down your sinks and traps, and this is full of like organic material, biofilm. Horrible, isn't it? And these are the organisms they can get. Again, this is another IV prep room. And look, can you see how the water's pooling? Yeah? And can you see there's another IV tray there? Well, guess what I found in that water? I actually found a carbapenemase producing Enterobacterales. So again, you can see organisms in your wastewater that you can spread about. So Martin, Kiernan, and I, and Phil, I did think Phil's here as well. There he is, waving at the back. We had many moons ago, we talked a little bit about, do you think is there such thing as a sink splash zone? So what we did some simple work. This was Ali Gardner at my hospital, an infection control nurse. I got her to put paper towel on the floor, right? And then I got her to run the sink. And then all we did is we wanted to see how far water could splash from that sink. And what we found, it could splash up to 2 meters away from the sink. That's quite a bit, isn't it? And when you do some kind of activity at the sink, you can see how you can splash even more water around that sink splash zone, can't you? Can you see that? Now, if you take a typical picture of one of our intensive care units, and you can see the tap there, look at the equipment, what's around there. There's loads of stuff, isn't it? Okay, you're not allowed to, but there's not a patient behind there at the moment, but the patient would be there behind. So water can splash onto your PPE, it can splash onto a trolley where you can have materials on, your computer on wheels, and it can splash onto the patient IV devices. So remember that when I showed you in the Burns unit, you can find Pseudomonas aeruginosa in the environment. Well, this is how you can find it. Now, there's some great work that Kathy Noakes up in Durham presented many moons ago, showing that when a patient showers as well, and showering, you can get an even wider range of splashing in that environment. So this is out in the next couple of days. So we've gone one step further from the sink splash zone. So this is it should be online in the next few days. We did some air sampling from the sink splash zone. So, okay, we've shown that water can splash, right? So what can we find in that sink splash zone? So we had a little air sampler. Can you see that little air sampler on the very left-hand side? The dot's not very good. And then we just ran the water, ran the tap, and then ran the air sampler and see what kind of organisms we could culture from that sink splash zone. And you probably can't see that. I put the agar plates on there, but you can see all the different types of organisms on there. So we've got like that nice little pink one is a Serratia. So you might have heard of Serratia before. So yeah, you can get various different organisms on there. So what did we find? We found Citrobacter, Enterobacter, Pseudomonas aeruginosa, Sphingobacterium, and more worryingly, what did I find? I found a CPE as well. One that is related clinically to our patient isolates. So genetically, we worked with the university. We found a CPE in that. We found that if you put filters on, or not, put filters on, it can affect your splash zone as well. How fast you get more organisms or less organisms, depending what you do and how vigorously you run the tap as well. Phil, I think, might be doing a little bit of work later, and he's here so you can chat to him. So Phil and I have worked a little bit together, looking at like the sink sink drains and things that we can do. It's actually on the other slide. Can you see those pictures at the very bottom? So we've looked at using UV to see how effective UV is at decontaminating the sink trap. You can also use chemicals. Can you see that biofilm there, that green biofilm on there, that big green biofilm? So you can use like compounds as well that can dislodge that biofilm, but they have to like accumulate there. So Phil and I have worked together on one of our wards over at Heartlands, and we've installed some UV sink traps, and what we found is they reduced the the microorganisms within that sink trap over time. So, floor scrubbers. This is some great work that came out from Nottingham on floor scrubbers. And these floor scrubbers, so anything, my point is anything with water tends to have some microorganisms in and create you a little bit of problems. So Nottingham, Tim Boswell's group presented an outbreak of a CPE, what was associated with the floor scrubbers. And again, we've looked into these floor scrubbers because they have a reservoir of water. And again, we can find various different organisms. Can you see that organism there? That's like that's a Rayotella, that's an Enterobacterales. And again, we found CPEs within that. So it's quite worrying. Anything with water and water reservoirs creates a bit of a problem. As Rose mentioned before my talk, there's loads of great work looking now at water safe care. I prefer the term water safe. And this was just some work done over in the Netherlands by Joost Hopman, who tried to create a water safe environment in their intensive care units. And this graph is just looking at gram-negative colonizations and infections, the very different time periods of the patients that are in. And can you see the gap in the middle? That's the intervention period where they try to use water more safely. And what you can find is the number of gram-negative colonizations and infections all reduced down by not using as much water. Giovanni Facchini, an Italian who works in Italy, lovely fella. He did a retrospective analysis on all the German ITUs, the intensive care units. And what he found was rooms with sinks were associated with healthcare-associated infections. So what he found, if a room didn't have a sink, the healthcare-associated infections reduced down. So there's loads of evidence there now around the role of water and transmission from the environment. When you're looking at like trying to sell this to your board, water even fits, a little bit smaller now, even on the NHS carbon footprint. So we use a lot of water in healthcare. So again, thinking of new builds and how we design new builds and our wastewater and our water, there are things that we can do from a cost and sustainability point of view to reduce that down. So my final thoughts, I've been 19 and a half minutes, so virtually spot on timing of the 20 minutes. Hopefully I've shown that we do see transmission of organisms from our water to our patients. So I've talked a lot about Pseudomonas aeruginosa because it's my favourite bug. But if you go into the literature, there's loads of stuff about Legionella, Cuprividus, Stenotrophomonas, lots of other pathogens that, I've talked about Pseudomonas. But the work around Pseudomonas can apply to the other organisms. I think, again, with everything in infection control, there's like engineering fixes, there's like, working with companies fixes. But again, it comes to human factors as well and understanding the importance of water. Sinks are a source of transmission. We see splashes, blockages, lots of different other things. And, do we go to using less water or using water more safely? And I think it's coming to me is using more water more safely. Can we put like a big red line around your sink and say no equipment within that 2-meter splash zone, thinking carefully around it. Again, all this work is not me. I'm just the face of a very good team that is actually working very, very hard while I'm here presenting. A few are in the audience. There's a great... Martin Kiernan's got a podcast, and I've talked about the sink splash zone on there, so that's about 20 minutes, half an hour. So if you want to go and listen to that, download his podcast and listen to it. I've also, John Otter, I don't know if John Otter's here, and Phil do, I've got an IPC Partners, and I've done a journal club on that as well, so I think that's probably online, isn't it? But you can ask Phil and John about that. So thank you for listening, and that's spot on like your 21 minutes, so thank you.